Hi, I'm Dr. Sarah Lindberg, a naturopathic physician at Sound Naturopathic Clinic, and we're going to discuss the importance of pain management injections, specifically PRP, which is platelet-rich plasma injections, and that typically helps with any sort of injury that hasn't gone away or can help with just pain management in general. So in naturopathic medicine, pain can be caused by countless of imbalances. It is a way that our bodies tell us to seriously pay attention to our physical body. Because of pain's complexity, it should not be treated simply or with suppression, especially steroids or steroid injections that people are getting. So PRP is platelet-rich plasma, and it is the balance of your own blood with the remodeling factors of the actual joint, ligament, and tendons, and placing them in the exact spot that needs to be healed. So plasma is high concentration of human platelets in a small volume of plasma, and plasma also has growth factors that aid in the healing and actual regrowth of the tissues in that area. Platelets also secrete the growth factors that initiate the wound healing. So growth factors have the ability to change into the tissue needed in that area. So benefits would include the actual help with pain and the inflammation in that area, to tighten the ligaments, increasing the stability of the joint as a whole, healing tears, quickening the healing of any sort of injury. It helps with acute and chronic pain. It also helps with collagen regrowth. Sometimes some people have meniscus tears, for example, and it can really help with that. Helps with skin rejuvenation, so it can be used topically on the skin. Helps to rebuild the actual cartilage and can reverse arthritis because it helps to build that joint back up again. So it's different from prolotherapy in that prolotherapy uses dextrose, which is a form of sugar, and an anesthetic. Most of the time it's procaine. And that leads to causing a minor inflammation, and then actually tightens all the ligaments and can help to stabilize the joint. But the PRP just is kind of more of a concentrated form and using your own healing properties in your blood. So that's why it's PRP is different from Prolo. So what you can expect from a visit is you would probably want to expect being in the office for about 30 minutes because you have to get your blood drawn. Usually it's about 1 or 2 of these tubes I'll usually draw, and then we have to wait for it to clot and then spin it down. And when you spin your blood down, it separates into 3 different layers. An olive oil looking layer, a buffy layer, which is more of a fatty layer, and then your red blood cells at the bottom. And so what we do is we extract this top layer that looks like olive oil, which has your platelets and all those healing properties in it that we need in a concentrated form. And then we put it into this syringe, and then this is the only ingredient that we are adding to this syringe, which is your own blood, and that's what we're injecting back into you. So as you can imagine, since it's your own blood, you're not going to have much of a reaction to it, because it's your own blood, so your body's not going to reject it. And what you'll notice after the injection is possibly maybe a little bit of fullness in that area, just because you are injecting a lot of liquid in there, and maybe a little bit of stiffness, but it should go back down to normal that night or by the next day. After the injection, you can go ahead and do the same errands that you're going to be running. Just make sure you're not doing heavy exercise, but by the next day, after about 24 hours or so, you should be able to go back to exercising, and you could probably go back into full full tilt exercise within 48 hours if you'd like, or beforehand. As a personal story of using PRP, I had a grade 2 or 3 ankle tear, and so I tried to do about 7 rounds of prolotherapy, which didn't touch it. It didn't help with the pain, and it didn't help with the fact that I couldn't exercise or do any sort of explosive, anything explosive off of my ankle. I couldn't even run to my car from the parking lot because it would be so painful to do that sort of explosion off of my ankle. And so after 1 round of PRP, the very next day I was able to run 6 miles. So if that is any amount of hope for anybody, I highly recommend getting a PRP injection. And it tremendously helped my quality of life to be able to exercise this in the same way and be able to go hiking, be able to go for a run and blow off some steam. And so I'm really happy that I was able to kind of get my life back when I got my PRP injection. And ever since, I've only needed maybe 1 more PRP injection, and it was after a year. So you don't have to keep getting injections necessarily, but it does depend on the patient and what is going on with your injury. Sometimes it can take a couple injections, but you will definitely notice a difference with your first injection. So if you have any other questions about PRP, please let me know. But thank you for watching this video, and I am Dr. Sayre, keeping you informed and healthy.